Oh, wow. That's
This is.
Oh, is that the same song that he liked?
Yeah, this is
From,
the English Beat.
Okay.
From Grosse Pointe Blank.
Yes.
Which was on the other day.
It was. Yes, I saw it too.
It was on the other day.
Yes.
Yes, and I thought of Tony Messenger.
I did too.
St. Louis Post-Dispatch columnist Tony Messenger every Tuesday and Thursday. Good morning, Tony.
I love it when you guys are thinking about it. That just makes me so happy.
Only sometimes when I'm thinking about you, not all the time.
Only sometimes.
All right. So I read with great curiosity the article you wrote, the story you wrote, about the doctor who they took to court for overprescribing pain pills.
Yeah, fascinating trial out of St. Louis this week. 7-day trial ended on Tuesday, and the jury, a St. Louis jury, found Flu Care and one of their doctors, a gentleman named Dr. Henry Walden, guilty of medical malpractice related to opioid drugs, pain medications. And the numbers in this case, this wasn't a wrongful death case. The gentleman who was his patient is alive. He's a City Parks employee. He and his wife, they're getting divorced now, but he and his wife sued the doctor. He went in for back pain and ended up over a 4-year period between 2008 and 2012 receiving 37,000 pills of various opioids, OxyContin, oxycodone, and Vicodin. He was on 3 of them at one time, at the same time. And these are the numbers that I think really got to the jury. The CDC, the Centers for Disease Control and Prevention, suggests that the daily average of pain medication that you should receive from, specifically if they're opioids, for non-cancer pain, and this is the key, they separate between those who are on cancer who are receiving opioids and those who are getting it for back pain or something else. If you're getting it for non-cancer treatment, you should be receiving no more than the equivalent of 100 morphine equivalent milligrams per day. They compare it to morphine just so that they're comparing all the drugs the same. He was on, at the peak of his treatment, 1,555 milligrams of morphine equivalent drug per day. Just an astounding number, and a number that all of the doctors, with one exception in the case that testified, said they had never seen, they had never prescribed themselves. And so the jury awarded the Coons $1.4 million for Brian, $1.2 million for his wife Michelle, and then they punished the doctor in Flu Care with a $15 million punitive award. And I think that is going to send some ripples throughout the medical community in the country as it relates to how they deal with prescribing opioids.
So you really think that this is a shot across the bow saying, clean up your act, doctors, and stop with these pill mills?
Well, you know, the process has already started. The CDC issued new guidelines this year, a whole series of new guidelines that they spent a lot of time working on that were controversial, because the fact is some people really need their pain meds. And so it's not a simple issue to deal with. But the medical community is coming to terms with the fact that over a period of the last decade or so, they went a little bit heavy on, a lot heavy on prescribing opioids and not controlling the dosage because of how addictive these drugs are. And that's really the key. These are really addictive drugs. And we here in St. Louis have been dealing with a heroin epidemic that is directly related to the opioid epidemic, because a lot of folks are getting their opioids from their doctor. They're having more than they need. They're ending up selling them, or they're getting stolen. People are getting addicted, and then when they lose their opioids, they move to heroin. And guess what? The heroin's cheaper. And so that problem that our community is dealing with, that's directly related to the violence that we're dealing with in our community, has a connection to this opioid situation. And that's why so many people are watching it so carefully.
Tony, how much of the fact that Missouri is the only state in the union not to have a list, a drug list, so that doctors can find out who's actually getting what, how much of that was brought up in this trial?
It was brought up a couple of times because the doctors who were expert witnesses noted it and pointed out that that could become a problem. It wasn't a problem in this case because the patient had no problem getting as many drugs as he needed from the one doctor he was going to. But here's the interesting thing about this case. There was evidence in the case that the pharmacies were being really responsible. The pharmacies were getting these massive prescriptions for opioids and these refills that were being refilled before this prescription was done, and the doctor would write new ones. And the pharmacies were calling the doctor and calling the healthcare system and saying, whoa, wait a minute. We're getting some big numbers here. Are you guys aware of what's going on? And the doctor went ahead and said, yes, go ahead and prescribe. This gentleman needs it for his pain. But that's an excellent example of why the drug database is so needed and why it's so ridiculous that Missouri is the only state in the nation that doesn't have one, because the pharmacies can play and do play an important role in making sure that people who are getting prescription medicines aren't abusing them.
That's Tony Messenger, ladies and gentlemen. He joins us every Tuesday, Thursday. You can read him, stltoday.com. Tony, have a good 4th of July. Thanks for checking in.
Thanks, you too.
825, Big 550.